Well, tonight, the price of proper care. Choosing a care facility is one of the most difficult decisions a family can make for their loved one.
But a CBS 19 investigation reveals deficiencies at several East Texas nursing homes. I talked to a family who's looking for change after their experience with a Tyler nursing home in this special report. 69-year-old Barbara Hayes is a great-grandmother to 12. She's at the stage of her life where she needs extra care.
I'm not asking for nothing special, no special treatment. Just do your job, what you're hired to do. That's all I'm asking.
Tamara Miller is Hayes' daughter. She and her two siblings want a safe place for their elderly mother to live. I met her in the parking lot of her mother's nursing home on the same day she drove to Tyler from Houston.
That makes me want to come more often, because what I've found with all nursing facilities is if you're not present, the less they care about your family.
Miller says she is losing trust in the facility. She says her mother doesn't feel like she's receiving the level of care she deserves.
When you go in this type of care, you have to have compassion. You have to think of it as that's my mother, or that's my father, or that's my sister, or that's my brother, and treat them as such.
But many nursing home facilities across the U.S. and the state of Texas have documented issues related to care that are publicly available online. ProPublica released a Nursing Home Inspect webpage that details violations for thousands of nursing homes and assisted living facilities. One example is Azalea Heights on Old Jacksonville in Tyler, where I met Tamara Miller and her mother.
It is what it is.
According to ProPublica, Azalea Heights has been fined $15,474 and has received 6 total deficiencies from June 2019 to June 2022.
Why do you have a $15,000 fine? And what are these deficiencies? I feel like they should be open. They should tell potential residents.
Some deficiencies at Azalea Heights noted in ProPublica's July 2023 survey include failure to distribute and serve food in accordance with professional standards or provide and implement an infection prevention and control program.
Quit giving them chance after chance after chance, because chance after chance it hurts me. It doesn't hurt them, it hurts me.
Hayes says she's not getting what she's paying for.
I'm using all but $60 of my Social Security to stay here. And for that kind of money, I would think that you would have somebody that would come in and change you when you need to be changed, not let you lay in feces or urine.
Azalea Heights declined to comment on Miss Hayes' experience or the reported deficiencies. Also in that report by ProPublica, Arbor Grace of Kilgore has 46 total deficiencies and 5 serious deficiencies from January 2020 to February 2023. With a 1-star rating according to Medicare.gov, the facility failed to provide appropriate treatment and care orders, resulting in a $208,000 fine back in January. Management there also declined to comment. And in Wood County, a nursing home with one of the most recent serious deficiencies in the state of Texas. According to ProPublica, Whispering Pines was cited for failure to honor the residents' right to a safe, clean, comfortable, and home-like environment in June of 2023. When I asked the administrator for comment,
I was called out here for you being out here for trespassing.
I was asked to leave the property. I asked the Texas Health and Human Services Commission about these findings. The agency said in part, quote, HHSC is aware of the report from ProPublica, which highlights nursing homes and their compliance history. Depending on severity of noncompliance, HHSC may also utilize enforcement remedies such as monetary penalties, directed plans of correction, directed in-service training, or facility closure. HHSC tells CBS 19 the facilities have 10 days to correct the violations. George Lineal is the president and CEO of Leading Age Texas. He says placing a loved one in a nursing home facility is a big decision.
They're under scrutiny a lot. It's hard for a poor facility to sort of slip under the radar.
Leading Age Texas advocates for families exploring retirement housing in nursing home communities. Lineal says when choosing a care facility, it's important you ask, what are your loved one's needs?
Is it the right environment? Is it do they provide the right services? If somebody needs memory care, does the facility provide an environment or specialization memory care?
He says deficiencies don't always point to a poorly managed facility.
Nursing homes are probably among the most highly regulated industries or fields in the United States. I think only nuclear power has probably more regulations than nursing homes.
Lineal says nursing homes in and around Texas are often short-staffed and workers are underpaid.
We're competing with fast food, with all kinds of industries for labor, and it's hard work. It's hard work taking care of older adults. People complain about, they want more staff, they want more resources, but you get what you pay for, and Texas needs to step up what they're paying for nursing care.
Lineal encourages those looking to place a family member in a facility to do your research and visit the facilities in person.
Don't just paint everyone. Not all nursing homes are terrible places. Several have excellent programs and excellent care for your loved ones.
Right now, Hayes and her family are uncertain about her future at the facility.
You feel so helpless, and it makes you feel like you're less than human. And I don't like that.
As CBS 19 continues to investigate, Miller hopes by publicizing her concerns, loved ones will do their homework.
And ask the hard questions. Don't just say, okay, here. Ask the hard questions and get hard answers, honest answers.
Facilities are required to be inspected once a year, generally by the state. Anytime there is a serious complaint, that's typically followed up by an inspection. Federal inspections are done at random. All this information can be found publicly online through the Center for Medicare and Medicaid Services.